Finally, after almost a full year onboarding with the operating theater, I will be off orientation next week. At least that's what my charge nurse told me. I'd still be probably getting precepted with a few surgeries, but basically at this point, I'm going to be completely on my own without any preceptors, and the staff will officially add me on as one of their nurses. It's been a long road to get to here, and I wanted to kind of share some of the things I've learned with the training. So, a little bit of backtrack. I started my OR nursing training all the way back in October of 2024. I got the job in September when I was applying to other OR nursing jobs right out of nursing school. And I actually got a job before this one in Massachusetts in Pennsylvania. It was in Erie, Pennsylvania, and I ended up going there and looking at the place, shadowing kind of. And I really didn't like the environment and the area. So when I found out that I got the job in Massachusetts, I was kind of thrilled and I decided to move here and start my training as an OR nurse right out of nursing school. I applied to a lot of jobs that were hiring for new grads. I got a bunch of interviews and it wasn't really difficult for me to get a specific job. I think what was difficult is just the moving challenges. And I think when I told a few people I couldn't move to a certain state, that obviously was a big reason why I didn't get the job. But I was able to move in Massachusetts because I had the funds, and right out of nursing school, I had a little bit of money saved up to kind of get me kickstarted and on that journey. So I started in October. The first couple months of the program was all just about scrubbing. So I scrubbed through all the service lines: general, GYN, urology, plastics, ENT. And basically, I was learning a second profession's job, which is a surgical technologist. And they go through a different program, and all they do in the OR is scrub. So, as an OR nurse, you need to know how to scrub because sometimes, if there are no surgical technologists that day, or if there are short staffed on surgical technologists, then a OR nurse needs to scrub for a couple of cases in place of that surgical technologist who's not there. I would say when it came to scrubbing, it was very different. Sometimes I would be assisting, but the vast majority of the time I would be passing instruments and counting and doing everything a scrub needs to do. I finished my scrub rotation around March, and then ever since March, I started circulating. So at this point, I have a couple months of circulating, and now I'm pretty much on my own. And the majority of my job here is going to be circulating. So on any given day, 9 times out of 10, it's going to be on the circulating role, not the scrub role. So I ended up circulating those service lines again in general, urology, GYN, plastics, and actually some vascular too. And now I'm doing orthopedics, which I've gotten very comfortable in for the majority of cases. And I think at some point I'll start circulating in cardiac surgery, but that's a little more down the road. It was a very long training program. I remember when I was about halfway done through my training, a lot of my other colleagues who I knew in nursing school who went to other specialties, they already finished their training months before I was even halfway done with my training. Many of my colleagues went to the ICU, they went to the ED, they went to the med surg floor, they went to oncology, they went to a bunch of different specialties, and it only took them maybe a month or two for them to get their essential skills to perform their job in those specialties. Whereas myself, I was basically relearning everything about the OR because nursing school does not do an excellent job at all of teaching us what the OR is about, nor is the goal really for most nurses to go into the OR. Nursing school really tries to push you to the floor, either the med surg floor or the specialty floors. Because back in the day, before 2010, the majority of nurses, after they graduated nursing school, had to start on a med surg floor before they can go into other specialties. But now that's not the case today, especially after COVID, where a lot of the requirements for entering into different specialties have become a bit more laxed. In terms of the preceptors I had, the majority of the time it was pretty okay, but one of the biggest issues I had with different preceptors was they would always tell me to do things their specific way. And Although that really wasn't an issue, every time you're with a different preceptor, they do things slightly differently. And they will get upset with you, or they might give you some critical feedback on not doing things their particular way, which kind of sucked. If the whole point of the training was for me to do things autonomously and developing my own flow of how I do my cases, it's not going to be conducive to my learning if I have to learn how people do things very differently. And you also got to remember the majority of the people in the OR, the nurses and surgical technologists, the vast majority of them that are on the staff have not graduated nursing schools since like 10, 20 years ago. It's a completely different generation of new nurses, such as myself, that are entering this particular specialty. So basically, we're just learning the old traits, which may or may not be evidence based practice or may be outdated, but we had to go with those practices because that's how those particular preceptors did things. So they were not really open to the way we learned the certain things or even new techniques that we got in nursing school. But now that I'm off orientation, I will pretty much incorporate anything I want into my own practice as long as it's not going against the hospital policy and as long as it's not a safety threat to patients during surgery, which everybody is on the same board as that. And now that I'm on my own, I don't have someone kind of breathing down my neck and giving me harsh negative criticism or feedback on how to do things their way, regardless if it's a way I prefer or if it's a way I think is a waste of my time. So that's kind of good to know that essentially I'll pretty much be doing things in my own rhythm and my own pace, and I don't have somebody breathing down my neck, stopping me every so often just to give me feedback on you're doing this wrong, you're doing that wrong. One of the biggest reasons new grads typically quit training in the operating theater is because they don't want to handle the different types of feedback they'll get from different preceptors because they feel like they're not developing their own rhythm and they feel stupid or they get yelled at and scolded at, which trust me, I have. I've gotten yelled and scolded at more by the nurses and surgical technologists than any of the surgeons. And because of that harsh feedback, especially when it comes to, during their training period, they typically feel intimidated and they don't want to stay and they end up going to a different place. Me, on the other hand, I was able to just kind of really put my head down and I really had to suck it up, if that makes sense. Because if I was in a position where I would complain or I would give different preceptors feedback on how other preceptors did it, then it wouldn't have been conducive to my learning and I probably wouldn't have the job. I remember when we were starting our onboarding, we had a surgical tech that just graduated and she also got the job in specifically our operating theater. And she ended up quitting the OR after a few months in. And it wasn't because of the job itself, but she was really talking back to a lot of the preceptors that were giving her feedback on different things, even if the feedback wasn't at all important or if it was just a minor criticism of the way she did certain things. Well, that ended up kind of backfiring on her because the management got involved and management's going to support their staff more than their trainees. So she ended up just leaving and she's still part of the hospital, but she is now in labor and delivery, which she likes a little bit better than the operating theater. So I have a feeling if I was able to talk back to preceptors and kind of do my own things early on, I would have probably been in that situation and I would have had to leave the profession myself when it came to training. So it did kind of suck for those past 10 months. And what I also don't like about it is certain people can take advantage of you, regardless if you know that or not. Just because you're new, you're very vulnerable and you are easily exploitable and you are not in a position of power or authority to speak up against these preceptors or to do anything because management's going to trust their preceptors more than they trust you as the trainee because you don't have that expertise and knowledge. So by default, you're really the bottom of the totem pole. And it kind of sucks. So one of the things I want to do if I'm ever in the operating theater and I have new trainees, I don't want to treat them the same way that I was treated in my training. I would like them to let me know when they need help and I just want to leave it to them and do their own things. Obviously, I'll intervene if it's a safety issue, but for the most part, The feedback I've gotten from preceptors really wasn't anything about safety issues. It was just more about their own preferences or their own tricks, and they got kind of disappointed when I wasn't doing things the way that they wanted to. And it's because of those things that I got yelled at and scolded at and really put in my place. And it's very disappointing to those out there who are in the OR, and maybe not in the OR itself, in any job profession. It doesn't have to be in healthcare, who are experiencing this. You're not alone. I experience it all the time, and I wish there was a different way of addressing these things. But my charge nurse told me at one point, it's really hard to do your job effectively when human beings are in the equation, meaning everybody is in a different position of authority, everybody has different preferences, and everybody has different opinions. And although that might be a gift in the sense of diversity, it can really be chaotic and hectic when it comes to agreeing on the fundamentals of how the flow of training should be. And to kind of conclude on everything, we ended up taking a operating theater test, the Periop 101 exam, which really just covered our modules. And it's developed by the Association of Operating Room Nurses, or AORN. And I ended up passing in the first try. That test wasn't going to really affect my employment, but it's just kind of good to have. So that way, if I ever had to switch hospitals or go into a different OR job, I know that the people that will be looking at my training will know that I have completed the fundamentals of the job, and I have a certification proving that I can do the job effectively. So what are the next steps now? In terms of the next steps, I'm probably going to stick with these people for the rest of the year. I have thought about it for quite some time, and once you have the year of experience in nursing, there's a lot of doors that open wherever you go. A lot of new grads aren't hired by other nursing departments because of the fact that if you have less than a year of experience and if you switch jobs, you have to undergo a whole new grad orientation and training program. But if you have a year or more of experience, by default, you're considered to be off training, off orientation, and have the necessary experience to do your job properly. And I'll have that 1 year of experience in just a couple months, because this coming October is only a few months away. And I was thinking of probably switching hospitals or going to travel nursing. I think it's time for me to make that change because I just want something different. And that's certainly an issue that most nurses don't contend with, but it's something that I shouldn't tell my management, because if they find out, then obviously they're not going to be happy with it, because management has different goals when it comes to the job than individual nursing staff. Management's goal is the bottom line and making sure that everybody is able to do their job, and they don't want you to go. They'll try to find ways to make you stay, but if you feel like you had enough of this exposure and experience in one hospital and you want to switch it up to another place, that's certainly fine with me. And nursing really gives you that opportunity to do so. So that's something I'll be probably looking forward to next year. I'll stay at Mount Auburn for the rest of this year, and again, I'm not sure where I'll be going next year. In the meantime, I'm just happy from all the training I've gotten, and now I know the basic fundamentals of circulating and scrubbing in the majority of the service lines. Yes, I still have like cardiac and maybe a few other sprinkled cases here and there, but essentially I'm going to be doing everything alone. And that's something that I've looked forward to for the longest time. OR nursing has the longest training period than any other nursing specialty out there. So in the operating theater, it's going to be about 10 months, 9 to 10 months. Some people can finish it in as quick as 4 months. Some people 5, 6, 8 months. But the majority of the time, it's going to take almost a year just for you to get comfortable enough to start doing everything on your own. And then once you're at that level, then you can certainly take your talents and skills to other places. Many thanks, and cheers.